Herpes simplex virus 1 and 2, HSV-1 and HSV-2, also known as human herpes virus 1 and 2, HHV-1 and HHV-2, are two members of the herpes virus family, Herpesviridae, that infect humans. Both HSV-1, which produces most cold sores, and HSV-2, which produces most genital herpes, are ubiquitous and contagious. They can be spread when an infected person is producing and shedding the virus. In simple terms, herpes simplex 1 is most commonly known as a cold sore, while herpes simplex 2 is the one known by the public as herpes, or genital herpes. Herpes simplex 1 is known to infect about 95% of the human populace, and is treated less seriously than herpes simplex 2, even though both are incurable. Symptoms of herpes simplex virus infection include watery blisters in the skin or mucous membranes of the mouth, lips, nose or genitals. Lesions heal with a scab characteristic of herpetic disease. Sometimes, the viruses cause very mild or atypical symptoms during outbreaks. However, they can also cause more troublesome forms of herpes simplex. As neurotropic and neuroinvasive viruses, HSV-1 and -2 persist in the body by becoming latent and hiding from the immune system in the cell bodies of neurons. After the initial or primary infection, some infected people experience sporadic episodes of viral reactivation or outbreaks. In an outbreak, the virus in the nerve cell becomes active and is transported via the neuron's axon to the skin, where virus replication and shedding occur and cause new sores. It is one of the most common sexually transmitted infections. HSV-1 and -2 are transmitted by contact with an infected area of the skin during reactivations of the virus. Herpes simplex virus, HSV-2, is periodically shed in the human genital tract, most often asymptomatically, and most sexual transmissions occur during asymptomatic shedding. Asymptomatic reactivation means that the virus causes atypical, subtle or hard-to-notice symptoms that are not identified as an active herpes infection. In one study, daily genital swab samples found HSV-2 at a median of 12–28% of days among those who have had an outbreak, and 10% of days among those suffering from asymptomatic infection, with many of these episodes occurring without visible outbreak, subclinical shedding. In another study, 73 subjects were randomized to receive valaciclovir 1 gram daily or placebo for 60 days each in a two-way crossover design. A daily swab of the genital area was self-collected for HSV-2 detection by polymerase chain reaction, in order to compare the effect of valaciclovir 1 gram once daily for 60 days versus placebo on asymptomatic viral shedding in immunocompetent, HSV-2 seropositive subjects without a history of symptomatic genital herpes infection. The study found that valaciclovir significantly reduced shedding during subclinical days compared to placebo, showing a 71% reduction. 84% of subjects had no shedding while receiving valaciclovir versus 54% of subjects on placebo. 88% of patients treated with valaciclovir had no recognized signs or symptoms versus 77% for placebo. For HSV-2, subclinical shedding may account for most of the transmission. Studies on discordant partners, one infected with HSV-2, one not, show that the transmission rate is approximately 5 per 10,000 sexual contacts. Effect of condoms on reducing the transmission of herpes simplex virus type 2 from men to women. Awald, Eigam Langenberg, K. Link, et al. JAMA. 2001. 285, 24, 3197. Atypical symptoms are often attributed to other causes such as a yeast infection. HSV-1 is often acquired orally during childhood. It may also be sexually transmitted, including contact with saliva, such as kissing and mouth-to-genital contact, oral sex. HSV-2 is primarily a sexually transmitted infection, but rates of HSV-1 genital infections are increasing. Both viruses may also be transmitted vertically during childbirth, although the real risk is very low. The risk of infection is minimal if the mother has no symptoms or exposed blisters during delivery. The risk is considerable when the mother is infected with the virus for the first time during late pregnancy. Herpes simplex viruses can affect areas of skin exposed to contact with an infected person. An example of this is herpetic whitlow, which is a herpes infection on the fingers. This was a common affliction of dental surgeons prior to the routine use of gloves when conducting treatment on patients.